I will be delivering the final arguments in favor of medical marijuana. Medical marijuana improves the quality of life in those with chronic illness. If there is an alternative treatment for patients to use that can increase their quality of life, it is the moral imperative of a healthcare provider to offer it. According to the Journal of American Medicine, potential benefits of medicinal cannabis for people living with cancer include antiemetic effects, appetite stimulation, pain relief, and improved sleep. The Journal of American Medical Association cites marijuana may have beneficial effects on pain control, appetite, mood, and management of other chronic symptoms. A 2011 article from the American Journal of Hospice and Palliative Medicine outlines other benefits including treating neuropathic pain, muscle spasms, fibromyalgia, and cataxia, as well as cannabidiol's ability to induce sleep and may provide some protection against seizures for epileptics. Other benefits include muscle relaxation, anti-inflammatory effects, neuroprotection in ischemia and hypoxia, and overall enhanced well-being. As with any medication, there are side effects of medical marijuana, including dysphoria, tachycardia, and motor/coordination impairments. However, benefits of using medical marijuana outweigh the risks. In a 2013 CNN special by Dr. Sanjay Gupta entitled Weed, viewers are introduced to Charlotte Figge, a 5-year-old suffering from a severe form of epilepsy known as Dravet syndrome, in which she has up to 300 seizures per week. With every option exhausted, Charlotte's parents contacted a grower who would breed a strain of marijuana high in CBD to lower the electrical activity in Charlotte's brain and low in THC, the aspect of marijuana that causes the high sensation. The strain was transferred to a liquid form and dropped under Charlotte's tongue. Charlotte is now down from 300 seizures to 1 seizure a week. In the same documentary, viewers meet Chaz Moore, who suffers from myoclonus diabetic flutter, muscle spasms occurring dozens of times per day, making it difficult for him to breathe and speak. Chaz was taking up to 16 pills a day, including dangerous muscle relaxers and narcotics, before he was prescribed medical marijuana. His father, Sean, says, "I am a firm believer medical marijuana has saved my son's life. His quality of life is now 1,000 times better than he was on all the pharmaceuticals." The first-hand positive experiences of medical marijuana cannot be overlooked. The improved quality of life for patients without the use of dangerous pharmaceuticals shows that the benefits outweigh the risks. Medical marijuana also has a lower abuse potential than most pharmaceuticals. In CNN medical correspondent Dr. Sanjay Gupta's article entitled Why I Changed My Mind on Marijuana, he states, "Marijuana, a Schedule I substance, leads to dependence in only 9 to 10% of adult users. By comparison, cocaine, a Schedule II substance with less abuse potential than Schedule I drugs, hooks 20% of those who use it. Around 25% of heroin users become addicted. In addition, physical withdrawal symptoms are nowhere near as severe as substances like benzodiazepines, alcohol, heroin, or cocaine." Contrasting the withdrawal effects of marijuana, including insomnia, anxiety, and nausea, to the withdrawal symptoms of benzodiazepines, including convulsions, catatonia, coma, suicide ideation, and even death. According to the previously cited article from the American Journal of Hospice and Palliative Medicine, overdose deaths involving prescription opioids from 2004 to 2007 revealed 1,668 people who died from prescription of opioid-related overdoses. Contrast these with the morbid trends and this well-documented fact. No one has ever died from an overdose of cannabis, and if cannabis-based medicines were more widely used, potentially thousands of deaths from opioid toxicity could be prevented. In addition, the article states a patient does not need to be intoxicated to seek a beneficial medical effect, and therefore abuse and those simply seeking a high feeling would not be as prevalent. Close monitoring of patients by prescribers and parents of underage patients can further deter the belief of high abuse potential. Because of the illegality and negative connotation created in the 1940s about marijuana and the subsequent label as Schedule I substance, research of the drug benefits and/or abuse have not been able to be studied as well as they could be. Had cannabis not been removed from our options 7 decades ago and remained available to treat chronic pain, potentially thousands of lives could have been lost that have been lost to opioid toxicity could be prevented. Medical marijuana also has the ability to produce decreased crime. Just as prohibition failed in the 1920s, so did the restrictions of medical marijuana. Decriminalizing medical marijuana and decreasing restrictions, and therefore making it more readily available to patients, can actually reduce the crime commonly associated with marijuana. According to the article in the Journal of Studies on Alcohol and Drugs entitled Exploring the Ecological Association Between Crime and Medical Marijuana Dispensaries, there were no observed cross-sectional associations between the density of medical marijuana dispensaries and either violent or property crime rates rates in this study. These results suggest that the density of medical marijuana dispensaries may not be associated with crime rates or other factors such as measures dispensaries took to reduce crime, for example, dormant or video cameras, and may increase guardianship such that it deters possible motivated offenders and thus reducing crime. According to the online article, Crime Down in States with Medical Marijuana Dispensaries, citing the FBI national crime rates, the western area of the United States saw the greatest decrease in murders and came in second to the Midwest in the greatest decline in violent crimes, aggravated assaults, and larceny. Given the fact that the majority of the states that have legalized marijuana are in the West, it seems as if legalizing medical marijuana, if it causes crime, then there would be an increase in these crimes, not a decrease. More importantly, this area shouldn't be part of the country with the greatest decline if medical marijuana causes crime. In summary, evidence and research illustrates that medical marijuana is safe and has health benefits. Legalizing medical marijuana as a medicine and changing marijuana from a Schedule II to a Schedule II substance would provide patients with autonomy by giving them all options to treat their illnesses and allow healthcare providers to adequately practice beneficence and non-malfeasance by providing a medication safer than the currently prescribed pharmaceuticals.
Okay, I will be discussing the final arguments against medical marijuana. I know we've all heard that marijuana is not addictive, but that is not true. According to the National Institute of Drug Abuse, about 9% of users become addicted to marijuana, and this number increases among those who start young to about 17%, and among daily users to 25 to 50%. Thus, many of the nearly 7% of high school seniors who report smoking marijuana daily or almost daily are well on their way to addiction, if not already addicted. Long-term marijuana users trying to quit report withdrawal symptoms including irritability, sleeplessness, decreased appetite, anxiety, and drug craving, all of which can make it difficult to remain abstinent. So why does it matter if you're addicted, and what are the effects on everyday life? Research clearly demonstrates that marijuana has the potential to cause problems in daily life or make a person's existing problems worse. In fact, heavy marijuana users generally report lower life satisfaction, poor mental and physical health, relationship problems, and less academic and career success compared to their peers who came from similar backgrounds. For example, marijuana use is associated with a higher likelihood of dropping out of school. Several studies also associate workers' marijuana smoking with increased absences, tardiness, accidents, workers' compensation claims, and job turnovers. Clearly, this is not a drug we want to give to anyone, especially young adults. Research has shown that in chronic users, marijuana's adverse impact on learning and memory persists after the acute effects of the drug wear off. When marijuana use begins in adolescence, the effects may persist for many years. Research from different areas is converging on the fact that regular marijuana used by young people can have long-lasting negative impact on the structure and function of their brains. A recent study of marijuana users who began using in adolescence revealed a profound deficit in connections between brain areas responsible for learning and memory. A large prospective study following individuals across time showed that people who began smoking marijuana heavily in their teens lost as much as 8 points in IQ between age 13 and age 38. Importantly, the lost cognitive abilities were not restored in those who quit smoking marijuana as adults. Because it seriously impairs judgment and motor coordination, marijuana also contributes to accidents while driving. A recent analysis of data from several studies found that marijuana use more than doubles a driver's risk of being in an accident. Further, the combination of marijuana and alcohol is worse than either substance alone with respect to driving impairment. This also could lead to increased crime and deaths in marijuana users. Associations have also been found between marijuana use and other mental health problems such as depression, anxiety, suicidal thoughts among adolescents, and personality disturbances, including a lack of motivation to engage in typically rewarding activities. Even with all these side effects and addictive qualities, some still argue that it should be used as medicine. Marijuana is simply not safe for medical use, especially for adolescents who are already at risk for so many of the mental health side effects. Adolescents experience many more of the addictive effects and the psychological effects. They are young drivers and are much more likely to be impaired by the drug than adults. They are also more vulnerable to the psychological effects such as depression, anxiety, and a lack of motivation. This increases their risk of dropping out of school and not having a job. The benefits do not outweigh the risk for this drug. The FDA has not approved this drug for two reasons. First, There have not been enough clinical trials showing that marijuana's benefits outweigh its health risks in patients with the symptoms it is meant to treat. The FDA requires carefully conducted studies in large numbers of patients, including hundreds to thousands, to accurately assess the benefits and risk of a potential medication. Also, to be considered a legitimate medicine, a substance must have well-defined and measurable ingredients that are consistent from one unit, such as a pill to injection to the next. The consistency allows doctors to determine the dose and frequency. As the marijuana plant contains hundreds of chemical compounds that may have different effects and that vary from plant to plant, its use in medicine is still difficult to evaluate. In conclusion, all of these reasons combined show that marijuana should not be used as a medical drug. It is unethical to prescribe this drug to a patient because the risks do not outweigh the benefits. It goes against beneficence because there is too much unknown about the long-term effects of marijuana used to safely prescribe it to patients.